Question number 4, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. Does he stand by Jonathan Coleman's statement that the government should have instigated a review of mental health services after years of evidence showing the system was failing people? If so, why is a review not needed now?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes, these paraphrased comments from way back in 2008 reflected the general concern at the time about Labor's management of the health system. A massive amount of work has been undertaken over the last 8 years, which has resulted in more New Zealanders gaining greater access to the mental health services that they need in a more timely manner. There's always more to do in this complex area, and 8 years on, a review is unlikely to provide any information that we don't have already.
Mr Speaker.
Supplementary question, the Honourable Annette
If
King.
a review was necessary in 2008, why does he deny one now when there are daily reports of failure, deaths in care, nearly 50% increase in 111 mental health calls, 6 DHBs reporting insufficient funding to cover services, DHBs underspending through lack of staff, and NGOs reporting they have reached crisis point?
The Honourable
Well,
Dr.
Mr
Jonathan
Speaker, I
Coleman.
dispute that range of assertions, but look, the fact is the number of people seeking mental health assistance from the system has increased from 96,000 a year a decade ago to 164,000, so there has been a big uplift. But at the same time, of course, there's more funding going in there, so it's gone up from 1.1 billion to 1.4 billion per year. We've got initiatives like the Prime Minister's Youth Mental Health Plan, the Like Minds Like Mine approach, the Rising to the Challenge mental health strategy. There's a lot of work going on, but I welcome the members' constructive suggestions, but unfortunately I don't think she's got any.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
I'd like to table an OIA from the DHB provider arm showing 12 months to June 2016, showing the data that I quoted about the underspending for lack of money.
The document's been described. I'll put the leave. Leave us sought to table that particular
question, Mr Speaker.
I just need to put the leave to see whether the document can be tabled. Leave us sought to table that particular OIA response. Is there any objection? There is none. It can be tabled. Supplementary question, the Honourable Annette King.
When he said in 2007 over 2,000 reported suicide attempts represented, quote, measurable outcomes in mental health, and by that criteria this government is failing, end quote, does over 3,000 reported suicide attempts, the latest figures available, represent his government's failing? If not, why not?
The Honourable Dr. Jonathan
Look,
Coleman.
I think the member's got to do better than dig up quotes from a decade ago. The fact is, this is always a complex area. The suicide rate actually per capita, listen to this, has dropped. Sorry? The suicide rate has dropped per capita over the last 5 years. It's a complex area, but we've got to do better all the time. That's why we're putting more resources into it. That's why there's a DHB Suicide Action Plan, a revised strategy that's been worked on, and there's more and more initiatives being rolled out in this area, but it's a complex and difficult one.
A question, Mr Speaker.
Supplementary question, the Honourable
When
Annette.
he said in 2006 it was particularly concerning that hospitalisations for suicide for young women had rocketed from 551 to 573 under Labor, how concerned is he now that the numbers have increased from 485 in 2008 to 726 in the latest figures available?
The Honourable Dr.
Look, actually,
Jonathan
I
Coleman.
dispute those figures, but the point is I think we should all be very concerned by the suicide rate. I don't think it's actually something the member should be playing politics with. She is not able to come up with a single constructive suggestion to tackle what is actually a very serious problem. So rather than just playing politics with it, I welcome one policy from Labor, and they haven't got a single one in this area.
Point of order, Mr Speaker.
Order.
I seek
Order. Point of order, the Honourable
Thank you,
Annette
Mr
King.
Speaker. I seek leave to table a Ministry of Health data set on suicide self-harm, a spreadsheet showing the figures I just gave for young women as being correct.
Order. The last part's unnecessary. Leave is sought to table that particular Ministry of Health data set. Is there any objection to it being tabled? There is not. It can be
Supplementary question.
Supplementary question, the Honourable Annette King.
How does he know the increase in mental health funding is being spent where it's needed when after 8 years in government he's still reviewing the suicide prevention strategy, still developing policy, still developing action plans, and is still months away from any decision? Isn't this just waffle and spin?
The Honourable Dr Johnson.
Look, all that's incorrect. We've got a ring-fenced amount for mental health. 1.4 billion per year goes into it. We've got this here. The member should read this. Rising to the challenge. This is the mental health plan published in 2012. The DHBs all have suicide action plans. They are being updated with new initiatives. There's a whole lot of work going on. And once again, I challenge the member to name one single policy response Labor has, because there isn't one, is there? No.
To ask the questions.
Order, no. Well, I'm here
Supplementary question, Mr. Speaker.
And I'm here to chair the session, so it'd help if we didn't have that in.
Supplementary question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
Does he agree with the Mental Health Foundation, who said yesterday that to prevent suicide in New Zealand, we need to take a hard look at the factors? And if so, why won't he undertake a review and address the underlying causes, including resourcing?
The Honourable Dr Johnson.
Look, Mr Speaker, of course we need to take a hard look at the factors, but this is a very complex area, and rather than the member continually playing politics, I welcome her constructive suggestions, but the problem is she's intellectually bankrupt and hasn't got a single idea.
Order, order. That last comment will not help. Order. 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 You've had your fun.